Hello again. In this segment, I'm going to discuss some issues and concerns commonly related to the treatment of alcoholism. This can be a very difficult population to work with, so several issues should be expected and prepared for in advance. One common problem related to alcoholism treatment is noncompliance. Alcoholic clients are often late, they're often absent for appointments, and this is especially true in the early stages, as clients don't really yet have that motivation to come to treatment because the ambivalence level is so high. Using motivational interviewing strategies may be used to resolve this ambivalence, as well as discussions with the client about the importance of regular attendance and being on time for appointments. If an appointment must be missed, if there's no other options, the client should know that the counselor should inform the client that he or she should call in advance to reschedule. Another issue is clients showing up intoxicated. If a client comes to an appointment drunk or high, the session should be canceled and rescheduled, and the counselor should make sure that the client gets home safely. They don't need to be driving home. Someone should be called to come and pick them up. However, coming to a session drunk could indicate the client is going through some sort of crisis, so this should definitely be addressed in the next session. Another issue, another area that often causes complications for treatment is the prevalence of other difficulties that often accompany alcoholism. Such difficulties might include anxiety disorders, mood disorders like depression or bipolar, suicide, which includes suicidal thoughts or suicidal attempts, personality disorders like APD, antisocial personality disorder, or BPD, borderline personality disorder, psychotic disorders like schizophrenia. Intimate partner violence is also common among couples who one or both partners have a problem with drinking. Other mental health problems, there's also, other than mental health problems, homelessness could be an issue that is commonly seen with alcoholic clients. So, research shows that a large number of those diagnosed with alcohol abuse or alcohol dependence also experience mental health problems, some of which I just noted. These problems may be the result of or antecedent to their drinking, or they may be coexisting. Depending on the circumstances of the disorders, clients may need to first be treated for their mental health problems and then for alcoholism, or vice versa. Either way, these difficulties do tend to complicate treatment in some manner. Another area of concern in treatment of alcohol use disorders is controlled drinking. Some clients come to therapy with the goal of controlled drinking. Their goal is, from the outset, I want to be able to control my drinking. Now, there's a lot of debate regarding whether or not this is a viable treatment option. It seems to be clear that abstinence is the preferred goal among clinicians, and it's also easier to maintain. It may be very difficult for clients who have drank uncontrollably for an extended period of time, months or years, to all of a sudden start drinking in a controlled fashion. One option is keeping controlled drinking a goal in hopes that the client will eventually see that it's not necessarily a realistic goal and that abstinence is probably the best way to go. Now, although some clients are able to achieve controlled drinking, it is often a more difficult task due to alcohol lowering your inhibitions. And, you have one drink, you say, oh, I can have another, and so it's just a more difficult task, or a more difficult goal to achieve. If a client decides on controlled drinking, the clinician should work with him to develop a controlled drinking plan, for example, only 1 drink per hour. Finally, counselors should be prepared to work with those who may not desire to change. These clients may be court mandated, or they may be sent to therapy by their spouse or parents or even their boss. When working with these clients, the counselor should expect resistance. They may not see that they have a problem, and thus they're going to be shut off to the treatment process. Many of these clients would obviously be in the contemplation stage, so MI strategies may be beneficial when working with these clients. Another strategy could be simply allowing them to discuss the areas of their life that are bothering them and that they don't see as being related to the alcohol problem. Eventually, they may start to see how alcohol is affecting those areas and how there is an impact with alcohol in their lives. So they may become more open to discussing their problem with alcohol. These are just some issues that counselors treating alcoholism face on a regular basis and should be given ample thought when working with this population. Thank you for listening. I'll see you in the next section.